Did you know that eating the wrong kind of nuts regularly can increase your risk of heart disease by nearly 48%? Yes. Even though nuts are often considered healthy, not all of them are safe, especially for seniors. A major study published in the Journal of the American College of Cardiology revealed that some commonly eaten nuts can silently raise blood pressure, trigger inflammation, block arteries, and even accelerate memory loss. What's more shocking is that many seniors unknowingly eat these harmful nuts every day, thinking they're doing something good for their health. One popular nut in particular, which we'll expose later in this video, contains a toxin that can damage your liver, kidneys, and brain, especially when consumed over time. It's hiding in plain sight, and chances are it's already in your snack bowl. But don't worry, we're here to help. In this video, we'll reveal which nuts are truly safe, which ones support heart and brain health, and which 4 dangerous ones you should avoid immediately. You'll get practical tips to protect your health and make smarter choices that truly benefit your aging body. So stay with us until the end. Your health may depend on it. And if you're new here, welcome to Senior Health Plus, where we share trusted, science-based health advice for people over 60. Like this video, subscribe to our channel, and tell us in the comments where you're watching from. Almonds. The bone-strengthening powerhouse almonds are one of the best daily foods for seniors. As we age, bone density naturally decreases, especially after the age of 65. This increases the risk of fractures even from small falls. Almonds can play a powerful role in strengthening bones thanks to their high calcium and magnesium content. Just a quarter cup of almonds provides around 97 milligrams of calcium, essential for maintaining bone mass. But it doesn't stop there. Almonds are rich in magnesium, a mineral that helps transport calcium to the bones instead of letting it collect in the arteries. This helps reduce the risk of arterial calcification and supports heart health, a growing concern for seniors. Almonds also contain vitamin E, a strong antioxidant that supports skin health and slows down cognitive decline. A daily serving of 15 to 20 almonds, preferably raw or dry roasted and unsalted, is ideal. Their fiber content, 3.5 grams per serving, also helps combat constipation, which affects about 40% of older adults. In addition, almonds help control blood sugar levels and support weight management by keeping you full longer. And here's a bonus. Almonds with skins contain flavonoids, which, when paired with vitamin E, double their antioxidant power. Safety tip. Seniors with dental issues or swallowing problems should chew almonds thoroughly or opt for almond butter. When consumed the right way, almonds can truly be a natural bone builder and heart protector in your golden years. Walnuts. The brain-boosting nut. Walnuts are often called brain food, and for good reason. Not only do they look like tiny brains, but they also provide powerful nutrients that support cognitive health in aging adults. Walnuts are the richest plant-based source of omega-3 fatty acids, especially ALA, which is essential for brain function and memory. As we grow older, our brain cells become more vulnerable to inflammation and oxidative damage. Walnuts help counter this by providing polyphenols, plant compounds that protect neural tissues. In fact, a study published in the Journal of Nutrition found that seniors who ate 1.5 ounces of walnuts daily for 8 weeks showed improved mental flexibility and processing speed. Walnuts also contain melatonin, a natural sleep hormone that declines with age. A small handful before bed may help improve sleep quality, something many seniors struggle with. These nuts are also good for the heart. They have arginine, an amino acid that improves blood vessel function, and antioxidants that reduce oxidative stress. Eating 7 to 9 walnut halves daily is enough to enjoy these benefits. Store them in the fridge to keep their healthy fats from going rancid. For those who enjoy a little challenge, Cracking walnuts also helps maintain hand strength and fine motor skills. While some may find their slightly bitter taste unusual, that bitterness is a sign of their high antioxidant content. For seniors looking to boost brain power naturally, walnuts are an easy and effective daily snack. Pistachios, the heart, and vision-friendly. Snack pistachios are a powerful yet underrated nut for seniors, especially when it comes to controlling blood pressure and supporting eye health. These vibrant green nuts are naturally low in sodium and rich in potassium, providing about 285 milligrams per serving, which helps regulate blood pressure by balancing the effects of salt in the body. Studies show that just one serving a day may lower systolic blood pressure by 3 to 5 points, similar to mild medication but without the side effects. Pistachios also contain lutein and zeaxanthin, two important carotenoids that protect against age-related macular degeneration, a leading cause of vision loss in older adults. They're gentler on the teeth than harder nuts, making them easier to enjoy for seniors with dental concerns. The act of shelling pistachios encourages slower eating, which helps prevent overeating and supports mindful snacking, perfect for portion control. Their rich color comes from powerful antioxidants that reduce oxidative stress and inflammation, both common issues in aging bodies. Aim for about 1 ounce daily, or roughly 49 unsalted pistachios. With 3 grams of fiber per serving, they also help stabilize blood sugar, great for the 25% of seniors who are diabetic or pre-diabetic. Brazil nuts, a natural thyroid booster for seniors. Brazil nuts are a powerhouse for seniors, especially when it comes to thyroid health. Just one Brazil nut provides over 130% of your daily selenium needs, an essential mineral for proper thyroid hormone function. For adults over 65, thyroid issues often go unnoticed because symptoms like fatigue and mood swings mimic normal aging. But selenium helps regulate energy, metabolism, and mood, making these nuts a natural ally in senior wellness. Beyond thyroid support, Brazil nuts help preserve the myelin sheath around nerve cells, improving reflexes and mental sharpness. They also offer antioxidants that may slow telomere shortening, a key factor in cellular aging and longevity. You only need 1 to 2 Brazil nuts per day to benefit. Their rich, buttery taste makes them satisfying, even in small amounts. However, avoid overeating. Too much selenium can be harmful. Peanuts, while popular, pose several concerns for seniors. First, they aren't technically nuts but legumes, and they grow underground, making them more susceptible to mold and aflatoxins, mycotoxins that can damage the liver and increase cancer risk. As we age, our body's ability to detoxify these harmful substances weakens, raising the potential for harm. Peanuts can also trigger inflammatory responses, even in people who don't have formal allergies. The proteins in peanuts may worsen joint pain, cardiovascular issues, and cognitive decline, common concerns for seniors. Additionally, peanuts are high in omega-6 fatty acids, which, if not balanced by omega-3s, can exacerbate inflammation. For seniors on blood-thinning medications like warfarin, peanuts' vitamin K content may interfere with these drugs' effectiveness. Moreover, commercially available peanut butter often contains hydrogenated oils, excess salt, and sugars, putting extra strain on the cardiovascular system. For seniors with hypertension, this is a major concern. Poor storage can cause peanuts to go rancid, producing free radicals that contribute to aging. Also, the dry roasting process used in peanut production creates acrylamide, a chemical that may affect cognitive function. Considering these risks, seniors should switch to healthier nut alternatives to reduce exposure to harmful substances. Cashews, while popular, pose unique risks for seniors. especially concerning blood sugar and overall health. They have a high carbohydrate content and glycemic index with about 9 grams of carbs per ounce. This can cause blood sugar spikes, a significant concern for the 25% of seniors with diabetes and 48% who are pre-diabetic. Despite their smooth texture and reputation, eating cashews in large quantities can worsen blood sugar regulation. Another risk is the choking hazard they present, especially for those with swallowing difficulties, a common issue among older adults. Cashews also contain oxalates, which can reduce calcium absorption, increasing the risk of osteoporosis and kidney stones in seniors. Additionally, cashews are processed to remove urushiol, a toxic substance found in poison ivy, reducing their nutritional value. Many cashews are also roasted in oil and salted, adding unhealthy fats and sodium that can worsen high blood pressure and stress the heart. Moreover, cashews contain enzyme inhibitors, which can interfere with protein digestion, a concern for seniors who already struggle with proper digestion. For healthier alternatives, it's advisable to substitute cashews with walnuts or almonds, which offer superior nutritional benefits with fewer risks. Macadamia nuts, although tasty, present significant health risks for seniors due to their high calorie density. With about 200 calories per ounce, macadamias are the most calorically dense nuts, which can make weight management challenging as metabolism slows with age. Additionally, their high fat content, about 22 grams per ounce, can strain the gallbladder, potentially triggering painful episodes in seniors with gallstones. Macadamias are also rich in saturated fat, which can raise LDL cholesterol levels, a concern for those with heart health issues. Their hard texture can damage weakened teeth and dental work, which is especially problematic for seniors. Furthermore, macadamias are often expensive, leading to the temptation to purchase improperly stored or rancid nuts. Many commercially available macadamias are oil-roasted and salted, adding unhealthy fats and sodium that may worsen blood pressure and heart health. For seniors, alternatives like pistachios or almonds provide better nutritional benefits without these risks. Pine nuts, while flavorful, pose several risks for seniors. They contain compounds that can interact with over 60% of prescription medications, including statins, blood pressure medications, and antidepressants, potentially reducing their effectiveness or causing harmful side effects. Many seniors are unaware of these risks, as healthcare providers often overlook food-drug interactions. Pine nuts can also cause a condition known as pine nut sickness, which leads to a bitter metallic taste that can last for weeks. This can significantly impact seniors, leading to decreased appetite and, in some cases, malnutrition. Studies suggest that 42% of individuals affected by this condition experience significant weight loss. Additionally, pine nuts are rich in polyunsaturated fats, which can oxidize quickly and create inflammatory chemicals, worsening conditions like arthritis. Their small size and slippery texture make them a choking hazard, especially for those with swallowing difficulties. Finally, new research suggests that chemicals in certain pine nuts may accelerate age-related macular degeneration, a leading cause of vision loss in seniors. To protect health, seniors should consider avoiding pine nuts, along with other risky nuts like peanuts, cashews, and macadamias. Making mindful dietary choices can lead to long-term health benefits.